So thank you, John, and thank you to everyone for this opportunity to speak from the patient perspective today. The Nystagmus Network prides itself on being able to make the voice of the nystagmus community heard in the fields of education, employment, medicine, research, and in everyday life. And when I say the patient, I'm really talking about these people here. These are parents and carers of children and young people who have infantile nystagmus, as well as living with congenital, infantile, and acquired nystagmus. First, I'd like to share with you briefly the story of my daughter's diagnosis. Although it happened 30 years ago now, sometimes it doesn't seem all that different from the experiences of families today. What happened was I took my baby along to clinic for her 6-week health check, and someone wearing a white coat and holding a clipboard virtually leapt across the table at me and told me that my baby was blind because they'd seen the eye movements. It was quite a shock, as you can imagine. I knew she wasn't blind, but I also did know there was something wrong with her eyes. So I went to my GP and I came away with this compliment slip with a handwritten message on it, nystagmus, one word, that was it. That's all I got from my GP. I've redacted the contact details on here, by the way, to protect the guilty. My GP was actually very good and I kept her for the entire time my children were growing up. But unfortunately, like many GPs, even today, she hadn't got a clue what nystagmus was, so she just wrote it down for me. And what you have to remember is that in 1991, when my daughter was being diagnosed, there wasn't any internet, so I couldn't even Google it. But the other thing she did give me was an urgent referral to an eye hospital. And I had to wait for that appointment for 6 weeks. So it was a very nerve-wracking time. A lot of parents even now get very little information at the point of diagnosis, very little more than I got then. If you're lucky, there may be some speculation about whether or not the child might ultimately be able to drive. That's a pretty blunt measure of vision as far as I'm concerned, and it doesn't really mean much to a parent who is more concerned about the first 17 years of life. We'd be more interested in knowing how we can stimulate their vision whilst it's still growing and what to look out for at nursery, or whether they'll learn to read and what might help them learn to read. That would be more useful. So we waited for the eye hospital appointment and it was a very stressful time, but we decided to have a day out at the zoo to entertain our young son. It was a really bright sunny day and my baby daughter screamed all the way there in the car. She screamed all the way around the zoo. She even screamed at the tigers and my son was appalled at this. He thought it was dreadful behaviour. And she was completely inconsolable. I couldn't feed her. She wouldn't be soothed at all. And she didn't settle until we got her home and put her in her cot, exhausted, and closed the curtains. And of course, you all know, and I know now, why she screamed. Because lots of children who have nystagmus are very light sensitive. If only somebody had told me that, my poor daughter. Unlike those tigers and the unicorn here, nystagmus isn't such a rare condition. So why is there so little knowledge of it in the general population and among GPs? How difficult can it be to pass on just a little bit of useful information at the point of diagnosis? Finally, the day came for my appointment at the ophthalmic hospital locally. And that day changed everything. The orthoptist we saw explained everything to us and answered all my questions. We left knowing roughly what to expect for the future, and we also had another referral to Guy's Hospital in London for a full raft of diagnostic testing. Crucially, the orthoptist also gave me a leaflet from the Nystagmus Network. And that evening, I called the helpline and spoke with my predecessor in this role, John, who many of you will know. The rest, as they say, is history. Because after that call and that connection with the Nystagmus Network, I found all the information and support I needed. I knew that with the right support, my daughter would have a bright future after all. and that there was a whole nystagmus community out there waiting for us to meet. Our confidence grew to such an extent that my daughter and I, with a little bit of help from my son, actually wrote the Wobbly Eyes Guide, which is a very it's still one of our most popular downloaded digital documents now. And yes, I am very proud of it. It explains nystagmus in language that a small child can understand, and it's designed to be used with parents, with their children, so that they understand about their eye condition. We do a whole raft of information documents, which you can download from the website, by the way. And yes, there is also one on driving. And my daughter is now living her best life. She did manage to get to school. There were a few bumps in the road. She went to school, she learnt to read and write, she went to university, and earlier this year she got married. As I and many, many nystagmus mums that I speak to say, if only we had known how she was going to turn out, we wouldn't have worried so much. If only we'd had a little bit more information at the point of diagnosis. We were very lucky. We happened to live in a town and within walking distance of an eye hospital. Sadly, it's no longer there now. But I'm sure its new residents are enjoying their luxury apartments. We were also a short train ride away from London, so we were able to go to Guy's, and we also went to Great Ormond Street. Most people are not so lucky. It is a postcode lottery as to how your child is diagnosed. It all depends where you live, it seems to me, as to how much information you get as a family, what diagnostic experience you get, and what services you're told about. And that can't be right. And this is why the Nystagmus Network is so pleased and proud to be part of NUC, the Nystagmus UK Eye Research Group. Because we have been working on something called the NCP. It's nothing to do with car parks, it's the Nystagmus Care Pathway. The aim was to ensure that wherever a patient is in the country, they will have the same diagnostic experience, the same care, and the same information and support. Families will be signposted to sensory support teams in their local area and get guidance on special educational needs, ensuring that their children achieve their academic potential. So they'll get the same advice wherever they are in the country. There'll also be, crucially, a conversation with the family about registering the child as visually impaired, which opens doors, of course, to support services and concessions and benefits for the family. And through an introduction to the Nystagmus Network, which is also in the NCP, the family, and to other charities, of course, as well, such as the RNIB, the family can join the nystagmus community and find what it's really like to live with a condition or support someone who does. This is another of our digital documents, and it's a compilation of comments and quotes from people who actually live with the condition, talking about their experience of living with nystagmus. And a lot of them are very different from each other, I have to say. And we would love as many clinicians as possible to read this document. Here's just one of the quotes, which very much reflects the Nystagmus Network's philosophy. People with nystagmus are so much more than just their wobbly eyes. So we're delighted that the Nystagmus Care Pathway has been accepted by the Royal College as a concise practice point. And this is what it looks like. And clinicians everywhere can now refer to it as the gold standard for nystagmus care at the point of diagnosis. You can download the document from the Royal College's website. It is a concise practice point, but it does include crucial information which a clinician could need. For example, this flow chart, it starts at taking the family medical history and goes right through various routes through different gene panels and tests to diagnoses of infantile nystagmus, ocular albinism, aniridia, and so on. And this is a very handy table of red and green flags, ensuring that potentially sinister causes of eye movements, which might look like infantile nystagmus, can be spotted early, and children displaying more typical symptoms can avoid a barrage of unnecessary testing. It also includes the three main groups of treatment options: optical, medical, and surgical. So NUC members have made a very short video to tell you a little bit more about the NCP, the Nystagmus Care Pathway, and you might recognise some of the speakers in it.
As researchers and clinicians who have been studying nystagmus,
we've become aware that the diagnosis and referral pathways for children are not always even across the UK.
This can lead, at times, to patients and families not receiving all the support they need.
And, at worst, this could lead to mismanagement.
The encouragement of Nystagmus Network, we came together as a group
to put together a plan of action to provide the information necessary for clinicians to take better informed decisions about this condition.
The various topics that we addressed were led by different members of our group according to their area of expertise.
Together, we authored a document for the healthcare professionals to consult when presented with children with nystagmus-like symptoms.
We were delighted that the Royal College of Ophthalmologists has recently approved our submission as an official, concise practice points document,
to which all clinicians at every level will have free access.
We look forward to our work having a beneficial impact on the future diagnosis and treatment of children with infantile nystagmus,
as well as providing better information and support for their families.
Thank you very much for your indulgence in listening to Patient Voice today. I can tell you that we are really grateful for everything you do, and I look forward to hearing much more from you during the rest of the symposium. Thank you.